Hi, my name is Latasha Smith, and I'll be presenting to you Transitions Theory by Afaf Meleis for the University of Hartford. Objectives that I will cover is I will introduce nurse theorist Afaf Meleis, explanation of the theoretical framework, discuss the nursing meta paradigm of the theory, strengths and weaknesses of the theory, how the theory relates to my nursing practice, and I'll cover a case study. Afaf Meleis was born on March 19, 1942, in Alexandria, Egypt. She was a professor of nursing and sociology and the former Margaret Bond Simon Dean of Nursing at the University of Pennsylvania School of Nursing. She was also a professor at the University of California, Los Angeles, as well as the University of California, San Francisco for 34 years. She published 3 books and is the author of over 200 articles in social sciences. She put a lot of focus on women's global health. An influential theorist that contributed to Afaf Meleis developing her transitions theory was Dr. Ralph Turner. Dr. Ralph Turner was a sociologist who was known as the father of the interactive role theory. This theory framed the nature and type of questions about how to help patients, clients, and families in their transition from one role to another, how to take on a new role, or how to change behaviors in a role. The theoretical framework for the transition theory generated research questions to serve as a guide to effective nursing care before, after, and during the transition. The nurse must analyze the goals, the patient's views on the situation, and behaviors necessary for the role he or she wishes to help the patient develop. So, what is a transition? A transition is the process from one life phase or condition or status to another. Afaf Meleis broke down her transition theory into 4 different types of triggers, transition triggers. The first one is a change in health or an illness situation. And this could be an example of getting the diagnosis of having cancer, heart failure, kidney disease, diabetes, something like that. Another transition trigger is developmental transitions. These transitions are manifested by life phases. This could be an example of menopause or becoming a new parent. Then we have situational transitions. And this is based on someone's experiences due to a situation and their response to that experience. An example of this could be just finding out that you're pregnant. The last transitional trigger that Afaf Meleis discussed was organizational transitions. So this type of transition doesn't only affect the individual, but it affects a community, an organization. So an example of this could be having a new nurse supervisor at your job. There were 3 patterns that guided the transitions theory. They were the role theory, lived experiences, and feminist post-colonialism. The role theory describes how an individual transitions from one role to another. For example, that could be a spouse now having to take on the role as caregiver to their significant other who was just diagnosed with cancer. Lived experiences. This focus on the response to change and the experience of the individuals going through that change. This takes into account the perceived views in regards to the situation compared to the received views to that situation. Feminist post-colonialism, that gives the framework for understanding the experience of transition through multiple lenses of race, ethnicity, nationality, and gender. This puts into perspective the inequalities that some experience, which may play a large role in how they perceive and cope with that transition. Nursing meta paradigm. So, the nursing meta paradigm is the person, environment, health, and nursing. So, the person refers to the patient who is receiving care. They focus on individualizing that specific care to the patient, and all aspects of the individual should be taken into account. The environment determines determinants of health, any outside factor that influence the patient's experiences. In health, health is one of the main goals of nursing. They focus on the overall well-being of the patient and many determinants of health. It's not necessarily whether you're sick or have illness. It takes into account mental health and the body as a whole. In nursing, it's the interpersonal interaction between the nurse and the patient, the facilitation of nursing care, and the building of trusting nurse-patient relationships. When relating the nursing meta paradigm to the transition theory, the person will be referred as the individual that's experiencing the transition. And for environment, this individual will require a very supportive environment in order for them to properly cope with the situation that they're going through. Without the proper support in their environment, it will be detrimental to their health. So, in order for the nurse to be able to promote overall health for the patient, they will require a supportive environment. And then for nursing, the nurse will have to gain trust in the patient, build a relationship so that they could best support this patient during this time. Strength and limitations of transitions theory. So, strength of this theory, from what I noted, is it gives nurses um, that are caring for these patients experiencing a transition, it provides patients with preventive and therapeutic interventions. It also strengthens the nurse patient relationship during a very vulnerable time. The only limitation that I saw to this theory was that I feel like it can become time consuming. Many individuals that are going through a transition tend to shut down, which means they may not want to communicate with the nurse. They may not quite know how to express their feelings. So the nurse would have to take the time to know how to properly go about building that trusting relationship with this individual so that they could gain information from the patient and provide that support they need to get through this transition in a healthy manner. And that may require a lot of time spent with them so that they gain trust in you. So, a case study that relates to my nursing practice as well as this theory is here um, in a patient that I take care of. So, this is a 62-year-old female who was diagnosed with heart failure 2 years ago. With this diagnosis, the patient became very depressed. She had to make many lifestyle changes. Physicians attempted medical management initially, but that wasn't enough. So she was listed for transplant. SL ended up receiving a new heart 3 weeks ago. Most will assume that now that SL has her new heart, she will be in good spirits and eventually will get to a point in which she can live a fairly normal life. Unfortunately, SL is in a state of great depression. She is extremely tearful and states she is having a difficult time coping. SL is refusing many of her medications that are supposed to help prevent her body from rejecting her new organ. She states that the medications upset her stomach. She was told to eat something before taking her medications, but she's barely eaten. SL appears to have given up on her life and doesn't seem to be willing to make any efforts to get stronger and do well with her new heart. So, with this case study, this patient is having a very difficult time coping with the loss of the the organ donor. So she's very depressed. So when relating this case study to the transitions theory, so the patient SL, she's going through in a way. So she's dealing with the diagnosis of she had the heart failure. Now she has a transplant, but there's still so many life changes she needs to make. She is having a very hard time. She's grieving very severely in regards to the loss of the individual that lost their life that gave her her heart. I've spoken to this patient, um, just trying to help her realize that this patient was an organ donor and now she has a new chance of living a better, healthier life. So she says she understands and wants to be happy and about the situation, but she just says she's very sad about it. I continue to talk to her and just try to help her cope with the situation in a positive manner, um, and just try to be the best support that I can for her. So I just feel like with this theory, it's just going to keep relating to the case study to the transitions theory. It's just going to be a lot of time spent with this patient, getting to build a relationship with her and just trying to provide her with the support she needs to realize that she has to make some changes. She has to take her medications. She needs to eat in order to do well. And for my nursing practice, I deal with a lot of heart transplant patients, heart failure patients, and a lot takes just with them with that diagnosis. You have to teach them coping mechanisms and ways to deal with the new diagnosis and just help guide them as best as you can. I hope you enjoyed my presentation and thank you for taking the time to listen. Thank you.